With the current pandemics ravaging the world, from Ebola to coronavirus and now monkeypox, the Ministry of Defense Health Implementation Program and U.S. Army Medical Research Directorate Africa this Tuesday commenced its biannual Site Commanders and Site Team Leaders meeting with the aim of improving the health of troops, their families and Nigerian citizens in general. Clearview's TV's Dorothy Monday covered the opening session and now reports.
The Ministry of Defense Health Implementation Biannual Site Commanders and Site Team Leaders meeting brought together the U.S. Army Medical Research Directorate and their Nigerian counterparts. These personnel from military medical facilities converge on Nigeria's capital, Abuja, to meet minds, collaborate, and discuss challenges, successes, and the opportunities in delivering quality health care to their patients. While declaring the two-day event open, Director General, Ministry of Defense Health Implementation Program, Brigadier General Okeji, retired, said the program, which was established 17 years ago, has grown in leaps and bounds, as has boosted the capacity of military health personnel and civilians in Nigeria, Ghana, and Liberia to respond to local diseases and pandemics. He also gave a breakdown of the successes made so far, to include establishment of 5 laboratories for research and effective service delivery.
The program, having been established 17 years ago, has also boosted the capacity building of military health personnel and civilians in Nigeria, Ghana, and Liberia to respond to local and regional epidemics. We have 5 laboratories of 5-star status for effective service delivery, training, and research.
The Deputy Chief Mission, U.S. Embassy, David Green, and the WRAIR Commander, Colonel Chad Kionin, in their separate remarks, expressed hope for the growth of the U.S.-Nigeria bilateral partnership in healthcare service delivery, as it has helped in reducing the impact of HIV and other diseases in member countries and communities.
The U.S. government's bilateral partnership between our Department of Defense and the Nigerian Ministry of Defense, and the collaboration of the 3 U.S. government health agencies under the HIV National Alignment and the Global Health Security Agenda have never been stronger. We wish to see these partnerships continue and advance to strengthen the health response of the Nigerian military, both within its own ranks and the communities it serves.
With joint efforts like these, we can continue to strengthen the international responses and reduce the impact of HIV and other diseases on our countries and our communities. Again, like the Minister of Defense, I congratulate all of you in this room on the tremendous successes to date and the tremendous successes to come.
Apparently elated by the partnership, Permanent Secretary, Ministry of Defense, Dr. Ibrahim Kana, said the collaboration between Nigerian Ministry of Defense and the U.S. Department of Defense has provided an exchange program for training of Nigerian and U.S. personnel.
The leadership of the Honorable Minister of Defense, and of course, U.S. Ambassador to Nigeria, who also co-chair the MOD, HIP U.S. Steering Committee that we have for this program. Their commitments to the goals of the program are responsible for the great strides that made this partnership a model worthy of emulation. I believe that this meeting will provide necessary platform for site commanders and team leaders to share ideas and experiences for the provision of enhanced healthcare services to the troops, their families, and civilians living in close proximity to the barracks.
Highlights of the biannual conference was the presentation of awards to deserving site commanders, team leaders, and permanent secretary. Dorothy Monday, reporting for Clearview Television.